Hi, my name is Tara Delaney. I'm a pediatric occupational therapist, and I'm executive director of Baby Steps Therapy, a not-for-profit clinic, as well as School Steps, a contract services company providing occupational therapy, speech therapy, psychological services to children with autism and sensory processing disorder, as well as learning difficulties. I'm author of 2 books, one on sensory processing disorder, the top 250 questions that parents and educators ask about sensory processing disorder, as well as a book entitled 101 Games and Activities for Children with Autism, Sensory Processing Disorder, and Asperger's Syndrome. One of the things I want to talk about today is how behavior impacts children with autism, or how the diagnosis of autism impacts behavior. That's one of the top things that parents are concerned about, is their child's socially appropriate behavior. And one of the things I learned about 20 years ago through working with children with autism was that behavior is not isolated. A lot of times we say, well, why is the child doing this? Is it the way that they're processing sensory information, or is that they don't want to be involved in an activity? And one of the things that I saw by working closely with families was how parents utilize sensory strategies as well as cognitive behavioral strategies to help their children cope in their daily lives. And when we look at behavior, so often people will say to me, now, is he doing that because he's seeking out sensory input, or is he doing that because he willfully doesn't want to engage in an activity? That's one of the top questions. Is it sensory? Is it willful? And one of the things I want to say about that is that the more we've learned through brain research and just anecdotal information working with children is that it's neither. You cannot isolate sensory versus learned behavior. And I think that's a really important thing to take home, that it's not, you can't pull that apart. So for instance, all of our behavior is how we react to incoming sensory information. So if you see something, let's say somebody's walking by you, you wave at them, or you're walking on the edge of a curb. You're processing balance information, and you are registering that information and responding to that information. That's behavior. How you register loud noises. Either you cover your ears or you walk out of a room. That's behavior. For someone that doesn't know how to react to that, escape that stimuli, they might scream. So one of the things when we look at helping children exhibit adaptive behavior, we have to look at both the sensory, how they're processing that sensory information, and the learned behavior. So when you look at sensory, you're talking about sensory integration, which was sensory integration theory was developed by Dr. Jean Ayres in the 70s. And then when we look at behavior, we look at B.F. Skinner's work of applied behavioral analysis. And a lot of times those two camps are separate, but it's much more powerful to put those together and utilize strategies from both of those camps to help children with autism exhibit socially adaptable behavior. And I think one of the best examples when we look at behavior to illustrate this point is picky eating. Picky eating is sort of the classic layered behavior. So what do you see when you see a child who is a picky eater? Often what you see is that child will only eat certain foods. So maybe they eat chicken nuggets, French fries, fish crackers. Well, a lot of times that behavior started out as a reaction to this tactile stimuli of different textured foods. So what happens is that child will try a food and respond to that stimuli. So for instance, you put something in your mouth and it doesn't feel right, so you go, and you spit it out. And so as a parent, and the most well-meaning parents, because our job in life as parents is to get our children to eat and not scream in public. So when you look at that as a parent, you say, okay, try that again. You try to coax your child. Then you see that behavior again, the spitting or gagging type, reflexive or respondent type behavior. What do? You pull that food off of the table. You don't continually offer that to your child because you want to offer them foods that you know they're going to eat. So what happens is they learn that I don't eat that food. I don't eat pancakes or I don't eat oatmeal. The reaction was responded, but now there's a layer over that, a learned behavior. So if that child's reaction was due to being tactily sensitive or exhibiting tactile defensiveness, and they work through that tactile defensiveness, let's say they're working with an occupational therapist who specializes in sensory integration, and they work through the tactile defensiveness, and now they'll touch different textures, they tolerate different clothes, and they can handle somebody being close to them, and now you see that the tactile defensiveness has decreased, but that child is still a very picky eater. One of the reasons is because there's been years of a learned behavior laid over the sensory reaction. That child has learned that this is all they eat. So after the sensory integration approach has been applied and that child will tolerate different textures, a behavioral approach needs to be put in place. A systematic approach to helping that child try different foods, expand their repertoire of foods they will eat. So you see this one behavior, picky eating, is really a combination of sensory reaction and learned behavior. We can look at a lot of different behaviors with this sort of different view, both sensory and applied behavioral analysis. And when we look at children with autism and we look at brain structures, it's really important to keep in mind how a child reacts to information. When in our brains, our amygdala allows us, is our fear response center. So it allows us to react to that incoming information in sort of a protective way. It is triggered by any perception of fear. So if you have a fear response, and then your frontal lobe allows you to lay over more intricate information about what's happening in your environment. So for instance, if you hear a loud noise, you suddenly turn towards that noise to get more information about that noise before you run away, before you scream, before you call 911, and you see, okay, it's somebody I know, they're running really fast or they're yelling because they want to get my attention. And you stop yourself and you say, okay, it's okay, it's just Sheila, she wants to ask me a question. And that is your frontal lobe abilities to lay over more information about anything in our environment that might cause a fear response. However, when we look at children with autism, we know that the amygdala and the frontal lobe are impacted when we look at brain structures. So a person with autism may be quicker to respond to fear and also slower to lay over that executive function information that rests in our frontal lobes. So one of the things that we have to work on is helping that person interpret the information in their environment and then lay over those executive function strategies. Again, that combination of looking at that sensory information with that behavioral information so that you change the outward behaviors and you equip people to respond in their environment in a socially appropriate manner. There's so much that we can learn by looking at both camps. And I just really appreciate everybody looking at going into it and looking at more information on sensory processing as well as applied behavioral analysis and not seeing those camps as isolated, but as working together to help children with autism. Thank you so much.